What are the possible signs of testicular cancer? What do a man to look out for?
Okay, testicular cancer is probably the only cancer in man where people can diagnose the cancer by themselves. So we routinely recommend young men to perform testicular self-examination in every month, like recommend women to perform their self-examination for their breast. So once the patient palpates or feels something wrong with their testicle, they have to be checked by a urologist in order to diagnose this cancer. And usually in the Western world, people are diagnosed with testicular cancer in the earlier stage because they are performing monthly testicular self-examination. But in the eastern part of the world, people are usually present with more advanced disease where the testicle is big, hard, and they have metastatic disease.
Who are in the risk group?
Okay, men between the age of 15 and 45 are the potential candidates for testicular cancer. Testicular cancer might occur even in older age groups, but we are more concerned for people between 15 and 45 years old of age.
Can testicular cancer spread fast to other organs?
It can spread to other organs, but it usually starts to spread in the abdomen, where we can see the retroperitoneal lymph nodes, and the next step is to the lungs. And unfortunately, if the disease is more advanced, it can even metastasize to the brain and to other organs. But the first two most common locations for metastatic disease is intra-abdominal lymph nodes and the lungs.
What are the common treatment protocols for testicular cancers? Is it a treatable disease?
It's a treatable disease. We usually start with orchiectomy, where we remove this testicle, and with this removal we get the pathology of the histology, the name of the cancer, and according to this specific subtype or subtypes, we can modify our treatments. There are treatment protocols where we use chemotherapy, where we use radiotherapy, where we use additional surgeries, but the outcomes of testicular cancer is usually higher than the other cancers.
The lump on the testicle, is it always cancer?
The lump on the testicle is not always cancer, but we should name it as a cancer as long as we remove them. So once we remove these masses, then we get the final pathologic results. But when the lump is small, usually smaller than 2 centimeters, there is a chance to have a benign disease. But after 2 centimeters, the chance of malignant disease is increasing.
Can men have children still after the treatment, or do you always suggest sperm freezing prior to the treatment?
Okay, we always recommend them to freeze their sperms before we start with these treatments, because the treatment modalities and usually the systemic chemotherapy will affect the remaining testicles. People with testicular cancer, they might have children after these treatments without using any assisted technique. So a spontaneous pregnancy may occur in these patients, but it's always great to have a backup in case of when the natural way of having a baby cannot be achieved. And in these people, probably 100% we can have positive results in order to have pregnancy, as long as the sperm we are preserving before the treatments is healthy.